All right, now we're going to move on to a different case that will allow us to go through some of the troubleshooting that can arise by commonly known things that happen in your clinic that cause this software to need you to place these points a little differently. So we first again assign the data. So we'll assign the mandible and the maxilla. We'll assign the ceph. And again, we can quickly assign the rest of these photos. It takes a minute, and then the doctor can always assess these in the future. I'm going to hit confirm here. Again, we'll skip over this stage because the software, the extra data on this is not a big issue. So this patient presented missing both the lower 6s and their lower 5. Now, as we talked about previously, the software is going to want to place the points on the cusp of the 4s as well as the distal buccal cusp of the 6s. However, in this case, there is no 6s for it to place, and so the software doesn't know where to place those points. So in this way, we're going to have to override and place these points for the software. So again, we'll place the points on the cusp of the 4s, and it doesn't matter which order, you can place these points wherever you want to. And then instead of trying to find a place on the 6, we're going to put it on the mesial buccal cusp of the 7s. Now, the big indicator here is we're getting as close as possible to where we think that would be. But again, as I mentioned previously, the big point is on the right-hand side here, does this accurately reflect where the occlusal plane is in this case? Now, if I'd like to manipulate it, it's much easier to manipulate it on the right-hand side. To manipulate the occlusal plane, if I hit the right click on my mouse, I can tip it and rotate it to where I want it to be. And if I click both left and right at the same time, I can move it bodily. So again, do your best by placing the points, but realize that at any point in time, I can adjust it on the right-hand side and get it to where I want it to be. If I don't like the placement, I can always detach the data, which is this button down the center here, and then replace the points again and start this process over. To me, for this instance, we'll say that's a good representation of the occlusal plane and move on. Now, this patient has a lot of wear, and the scan has some other, not great parts to it. So it's not the best scan, and there's a lot of wear. And so therefore, the AI is going to have a difficult time finding and separating these teeth. So again, first job is to go through and start counting. Are the teeth numbered correctly? And you can see this 1-4 is actually doing 2 teeth at one time, which is incorrect. So I'm going to click this 1-4. If I want to change the number, I can change it here. So if I identify the tooth wrong, I would just click 1-4, and I can click 1-5 here. And now this is going to identify both these teeth as a 1-5. So, but anyway, we'll go to 1-5 and we'll hit edit. And this is how we can edit what the AI sees. So my recommendation is always to hit clear all, which then allows me to start over. And being that I am trying to identify the 1-5, there's a wizard that automatically comes up, or if I double click with my left click, it usually does a fairly good job of identifying that tooth. And I can right click and rotate the model around and make sure it's painted how I want it to be painted. I can also use a brush or a deselection brush if I want to be more particular or if the wizard's having a hard time. But in this case, it did a very nice job. So then I hit the check mark to secure that. Now it cannot find anything on the 1-4. So the 1-4 over here is grayed out. So I'm going to left click on this and hit fine tooth. And now again, using the wizard, I just double click with my left click. It did a very nice job. It missed this section over here. So I can double click again and make sure that that's covered. If I want to get real particular around here, I can use this brush feature and brush in that little area. And I can rotate around and that looks like a pretty good job right there. So again, hit the blue check mark and that's identified it well. So now finish counting through these numbers. I look at the upper and look at all the painting. That looks like it's a good job. Now I look at the lower and I see, okay, the numbering's correct, but remember, it does not have teeth in these positions. Now, if I do nothing, it's going to close those spaces, which is probably not ideal in this case. So I'm gonna come over here on the left-hand side. You can see the 3-6 here is grayed out. I'm going to left click on that. And then I'm going to put a planned prosthesis. So I'm going to put it, I'm indicating the software, I'm going to put an implant or some sort of bridge in there and put some sort of tooth that's going to fill that space. And I'm also going to do the same thing with the 4-6 on this side and with the 4-5 on this side. And that's going to fill in those gaps and put a tooth from either the library or flip it from the other side and make sure that we're maintaining those spaces and planning out for where we're going to put an implant or some sort of restoration. So once I've identified all that, Other features we can do here is if there is if I left click on any tooth that's already been identified, I can do a planned extraction, a planned prosthesis, a primary tooth. So if this was a child and they had a primary tooth, if I chose to label it as a primary tooth, it's going to change the numbering, as well as in the simulations, put a permanent sized tooth in that place so that we can properly manage the diagnosis for planning ahead for when the primary tooth are coming in. Partially erupted tooth is going to behave very similar to how the primary tooth is. If the patient already has an implant, you're going to want to pin that tooth because an implant can't move. And so by pinning that tooth, it makes sure that the software doesn't try to move that tooth in the simulations. From here, this looks good. I'm going to hit next. Again, I insert a supplementary x-ray into this case. Again, the blue lines don't really matter. I can move those around if I want, but I'll just hit next on this one. Now again, because this case is missing the lower sixes, the software has a hard time matching this model to the Ceph. So as I mentioned previously, the way to solve this problem is I need to identify a point on the anterior and the posterior of the mouth that I can see on both the Ceph and on the model. So generally on the anterior, you're going to use the incisal edge and place that same point on the incisal edge, and you can place these in whatever order you want. And you're generally going to find a point on the posterior of the last tooth that I can easily identify in the Ceph as well. So once I place those 2 points, it now lines this up, gives me my Ceph numbers. If I misplace those, I can either detach the data. I can also right click or left click and move this around as necessary. But now this is attached on, I can click next. Again, we'll choose an arch form, and shift this arch form to where we want it to be. And then we'll move on. And again, because we're missing those lower sixes, it doesn't know how to identify it. Now again, we can use the cuspid, so I can move these around and try to find the right distance and to accurately reflect the amount of class 2. I can also just override it by calling it a class 1 or class 2. So your doctor can, again, if he wants to consider the bite classification in this case, he can look at this case and try to decide what the amount of class 2 is in this, or you can always override it by here. So as a dental assistant, you may just want the doctor to be able to go back and do that and just hit next and allow him to go back and change it as he chooses. I hit next, and now it's going to generate this simulation. One of the beautiful parts about this software is it will fill in those holes, put implants or teeth into those, so that the planning with restorations is done very nicely. So I hope by seeing these 2 cases, you get very good at moving from the initial scan all the way through the simulation stage and preparing this case to be able to diagnose chairside, include the patient in the treatment decision, and really use this tool to make orthodontics much smoother and much better in your practice.